In the counties of Nakuru and Narok in Kenya, collaborative efforts between the public and private sectors, known as PPDP, are fundamentally reshaping the local landscape through various development projects and transformative investments. These initiatives hold the promise of unprecedented prosperity for the future, but also pose the challenge of navigating the complex web of community impact. A dedicated team of researchers from Strathmore University is embarking on a journey to engage with these communities, listening to their narratives and gaining insights into the daily struggles they face, as well as the ways in which local development projects are impacting their lives. In this episode, the research team investigates how partnerships between the public and private sectors, PPDP, can enhance access to healthcare for the community and other rights-based services, affecting vulnerable groups such as girls and women. In these areas, there are limited healthcare facilities similar to this one in Suswa, all backed by diverse development partners. While this healthcare facility caters to women requiring maternal care from the neighboring community, its distance poses a challenge for some locals, particularly considering the condition of the access roads. Furthermore, it operates only during daytime hours. Here we meet Sylvia, a young student pursuing clinical medicine, whose inspiration to enter the field stems from a desire to tackle the challenges of maternal health in her community.
Maternal health care is very important in our community because so many women deliver at home, which is associated with a lot of complications such as postpartum hemorrhage. Some even are at risk of losing their lives. This is the only facility here around this place that offers maternal health care, and I come far from, our community is situated 10 kilometers from this facility. And the roads are not in good condition. So by the time a mother gets to labor and comes to this facility, that takes them a lot of time, and maybe they are highly progressing to labor. So it has been a challenge in our community for a long period of time.
Adding his voice to the challenges of maternal health care in the region is the local chief, who also happens to be Sylvia's father. Drawing from personal experience, he intimately understands the tragic loss of innocent lives that occurred before the establishment of the healthcare center.
Before we had this facility, sick people were taken to Kijabe, to Naivasha for treatment, and we had those challenges, and that one was very terrible because I had encountered one of the patients who was unable to deliver at home, and I personally took her to Narok District Hospital in the night. It was very challenging, and when we arrived to the facility, the lady got treatment she required. Unfortunately, the infant never succeeded.
In my career, I would want to explore more on reproductive health in obstetric and gynecology, like female health. For example, FGM is a key point in our community, and it affects a lot of girls. It hinders them from pursuing their courses because they are at risk of getting early marriages.
Despite widespread condemnation of female genital mutilation, FGM, in Kenya, certain pockets of resistance persist within this community. In these areas, some view FGM as a crucial traditional rite of passage for girls, deeming it necessary for them to be recognized as adults in their community. To aid the researchers in comprehending this issue, Sylvia assembles some of her younger relatives at home. They share their perspectives on addressing the challenges of female genital mutilation, FGM, and provide insights into how mentorship and protective measures for girls could be instrumental in tackling the issue. These girls are fortunate to have avoided undergoing the cut, attributed partly to the safeguarding efforts of the chief and other rights groups in the area. These groups have received training on children's rights, contributing to the protection of girls from harmful practices.
Numerous girls undergo the practice due to cultural expectations. Many lack a complete understanding of the consequences.
Whom do you think needs to be educated more or be made aware more about the effects of FGM so that this thing is killed off?
I guess it's girls. Girls.
Girls?
Yeah.
The girls?
Yeah.
Who else?
even the parents, like the mothers, you know. Now,
Even if the father declines, if the mother is still interested, the circumcision of the girl can take place without the father's knowledge. This is often the case as fathers are frequently absent from home. In this area, there is no local rescue centre. The closest one is in Narok town. Having a nearby centre could be immensely beneficial, especially when a girl refuses to undergo the traditional cut but lacks a safe haven. Families typically keep the specific day of the cut a secret, catching the girls off guard and denying them the opportunity to refuse. Establishing a rescue centre in the community could provide essential support for these girls.
In the next episode, the research team continues to explore how the empowerment of women and other marginalized groups through skill training programs in the community is one of the critical success factors or pathways to achieving positive transformation.